I. The American Anxiety versus the Silver Tsunami. If you are watching this, you are likely in your 40s or 50s living in the United States. You are part of what sociologists call the sandwich generation. On one side, you're trying to fund your children's education and manage your own career. On the other, you are watching your parents grow older, their health declining, and the terrifying reality of American elder care looming over your family's finances. In the US, aging is often treated as an individual failure rather than a societal inevitability. Medicare doesn't cover long-term custodial care. Medicaid requires you to essentially bankrupt yourself, spending down your assets until you have almost nothing left before the state steps in. It's a system that strips away dignity and generational wealth in a matter of months. But 6,000 miles away, a different reality exists. Japan is the oldest country on Earth. Nearly 30% of its population is over the age of 65. By all conventional economic models, this silver tsunami should have collapsed their healthcare system, bankrupted their youth, and stagnated their economy. Instead, Japan has engineered the most comprehensive, financially stable, and dignified elder care system in the modern world. They didn't achieve this through miracles, but through a ruthless, calculated overhaul of their national policy, insurance mandates, and community infrastructure. Today, we are going to dissect the Japanese blueprint. We will look at the exact policies, the financial architecture, and the societal shifts that allow the Japanese to age without the terror of going broke. And more importantly, we will ask, what can America learn before our own demographic time bomb goes off? Act 2. The Masterstroke. Kaigo Hoken. Long-term care insurance. The bedrock of Japan's elder welfare system was laid in the year 2000 with the introduction of Kaigo Hoken, the long-term care insurance system. This isn't welfare. It's a mandatory universal social insurance. Here is how the financial mechanics work. In the US, you might buy private long-term care insurance in your 50s, only to find the premiums are thousands of dollars a year with massive deductibles. In Japan, the moment you turn 40, you begin paying a mandatory premium into the Kaigo Hoken system. It's automatically deducted from your paycheck, split between you and your employer, much like Social Security in the US. Why age 40? Because that is the exact age when people begin to see their own parents decline. By tying the financial contribution to this psychological milestone, the government achieved massive public buy-in. When a Japanese citizen turns 65, they become eligible to use the system. An assessor visits their home and evaluates their needs on a strict, data-driven scale of 1 to 7, from requiring minimal assistance with groceries to requiring full, round-the-clock bedbound care. Once assessed, the system is breathtakingly generous. The insurance covers between 70% and 90% of the total cost of care. For the vast majority of seniors, their out-of-pocket copay is strictly capped at 10%. And it's not just for nursing homes. Kaigo Hoken heavily subsidizes at-home care. Need a specialized hospital bed? Rented for pennies on the dollar. Need a wheelchair? Covered. The system will even pay a contractor to come to your house, widen the doorways, and install handrails in the bathroom to prevent falls. The financial logic is brilliant. Spending a few $100s today on preventative home modifications saves the system tens of thousands of dollars in hip replacement surgeries tomorrow. ACT, the medical safety net, capping the downside risk. But long-term care is only half the equation. The other half, the one that keeps Americans awake at night, is acute medical care. Cancer treatments, surgeries, ICU stays. In the US, even with Medicare, the gaps in coverage can trigger a catastrophic financial drain on an estate. Japan eliminated this systemic risk through the Koki Kureisha Iryu Seido, the late-stage medical care system for the elderly. When a Japanese citizen turns 75, they are automatically enrolled in a specialized medical insurance tier. In this tier, the copay drops drastically. Most seniors pay only 10% of their medical bills. Only those with high incomes comparable to active workforce earners pay 20% or 30%. But the true masterpiece of Japanese healthcare policy is the out-of-pocket maximum, or the high-cost medical care benefit. In America, maximum out-of-pocket limits on private plans can still reach $9,000 or more annually per individual. Japan imposes a strict monthly ceiling based on income. If an elderly person requires complex surgery and extended hospitalization, and their 10% copay exceeds their designated monthly ceiling, often just a few $100s, the government halts the billing. The state absorbs the rest. This eliminates the concept of medical bankruptcy. It means an adult child in their 40s does not have to liquidate their parents' home or drain their own 401k to keep their mother on life-saving medication. The downside risk is mathematically capped. ACT IV. Pensions and community. The infrastructure of dignity. Financial subsidies mean nothing if the physical environment is hostile to the elderly. Japan realized that warehousing the elderly in isolated clinical nursing homes was both cruel and economically unsustainable. Their pivot was the community-based integrated care system. The goal is simple: allow seniors to age in place in the neighborhoods they know until the very end of their lives. This is where silver housing comes in. The government heavily subsidizes public housing complexes explicitly designed for the elderly. These apartments feature zero-step entryways, wheelchair-accessible layouts, and 2 4-hour emergency monitoring systems. They are built near public transit, grocery stores, and clinics, preventing the elderly from becoming prisoners in their own homes when they can no longer drive. To fund their daily lives, seniors rely on the Nenkin, the Japanese pension system. It operates on 2 tiers. The foundation is the national pension, mandatory for all residents aged 20 to 60, providing a baseline survival income. On top of this sits the employee's pension insurance, scaled to a person's lifetime earnings, much like the American corporate pension of a bygone era. While the payouts are not extravagant, when combined with subsidized housing, capped medical costs, and 90% covered caregiving, the pension provides a sustainable baseline for dignity. Furthermore, local municipalities actively fund Rojin Kurabu, or senior citizens clubs. These aren't just bingo halls. They are highly organized networks focusing on preventive health, volunteerism, and social integration. The government knows that isolation breeds depression and cognitive decline. By investing in community socialization, they drastically reduce the long-term medical costs associated with dementia and mental health crises. Act V, the macro view. How do they afford it? As an American watching this, your immediate question is likely, how on earth does Japan afford this? In the US, politicians constantly warn that Medicare and Social Security are hurtling toward insolvency. If Japan is older and their benefits are richer, how have they not collapsed? The truth is, it isn't easy, and it isn't free. Japan's system requires immense financial discipline and societal sacrifice. First, the cost burden is distributed with ruthless efficiency. The long-term care system is funded exactly 50/50. Half comes from the mandatory premiums collected from everyone over 40. The other half comes directly from public tax revenues, split between the national government, prefectures, and local municipalities. To generate this tax revenue, Japan has had to make tough political choices. Over the past decade, they have incrementally doubled their national consumption tax, similar to a sales tax, from 5% to 10%. Every time a citizen buys a coffee, a car, or a piece of clothing, a portion of that tax goes directly into the Social Security and elder care funds. It is a regressive tax, yes, but it ensures a massive, steady stream of revenue that cannot be easily evaded. Secondly, Japan aggressively controls medical pricing. Unlike the US, where hospitals and pharmaceutical companies can largely set their own prices, the Japanese government dictates a national fee schedule. Every procedure, every MRI, every pill has a strict price cap negotiated by the state. A doctor in Tokyo charges the exact same amount for an X-ray as a doctor in a rural village. By capping the profit margins of the medical industry, they prevent the systemic price inflation that plagues American healthcare. Is the system under strain? Absolutely. As the population continues to shrink, there are fewer young workers to support the growing base of seniors. Japan is currently debating raising the co-pays for wealthier seniors and increasing the premium age. But the core philosophy remains untouched. Elder care is a collective national responsibility, not an individual family crisis. Act V. The lesson for America. The American system is built on an illusion, the illusion that if you just work hard enough, save enough, and invest wisely, you can individually outrun the reality of aging. But dementia does not care about your stock portfolio. A sudden stroke does not care about your business acumen. Japan looked at the demographic data decades ago and realized that individual financial preparation was statistically insufficient for a macro-level aging crisis. They built a system based on pooled risk and mandatory contribution. For Americans in their 40s and 50s, the Japanese blueprint offers a stark realization. We cannot import their system overnight. Our tax structures, political ideologies, and healthcare industries are vastly different. But we can change the conversation. We can demand policies that incentivize at-home care over institutionalization. We can advocate for out-of-pocket maximums that prevent middle-class families from being wiped out by a single illness. Aging is not a disease we can cure, nor a failure we should hide. It is the natural progression of life. Japan has proven that with foresight, data-driven policy, and a commitment to collective dignity, a society can grow old gracefully. It's time for America to look across the Pacific take notes and start building a blueprint of our own.